what the B sharp means. You're looking for things that will kill the patient. So the B is the breathing, the E is electrolyte, S is shock, uh, then shock and sepsis, H is hypothermia and hypoglycemia, A is airway, which is number one, R is neurological problem, and P is pain. So you're looking for things that may kill the patient. Sometimes you may not see the same thing in the question that relate to B sharp, but it requires you to think. If you think that way, you may always relate it back. So, what do we have? The best way to answer prioritization question two, don't look at the diagnosis too much and just forget about what is exactly is going on. Here they said a client on Coumadin and a tarry black stool. Coumadin, what is the problem with Coumadin? Bleeding. The patient has tarry black stool. This is not normal. That is upper GI bleed. So this patient needs to be seen. His bleeding will go into shock. That's part of the B sharp. A client on spironolactone and a peak T wave. What is happening? Spironolactone, you got to bring your content. It's a potassium sparing. Now we have a patient with a peak T wave. What is peak T wave on the EKG? It's related to what? Potassium. Therefore, if the patient has spironolactone, it's increasing patient potassium, and now a peak T wave, this patient needs to be seen. And it's part of the B sharp, like I said. It's still part of the B sharp, which is the electrolyte. A client with SIDH prescribe 0.45% sodium chloride. What is SIDH? High level of ADH. What does ADH do? It tells the kidney to reabsorb water. And so when you reabsorb water, urine output is low. Your urine specific gravity is high. Your serum osmolarity is what? It's going to be low. And your sodium is going to be low. Patient is going to be hyponatremia, and therefore their sodium probably is like 130. And if you don't take care of it, they go into seizure. What you need to do is to replace their sodium with 3%. So any fluid that is not 3% or 5% is wrong. You restrict them free water, you don't give them free water. So 0.5% of normal saline, even though you're giving them a salt, is too low, it will dilute the sodium more. Therefore, this one need intervention, right? We're doing something wrong to the patient. Yes, SIDH, I should not prescribe abnormal saline. I should give the patient 3 to 5% to bring their sodium up. Number 4, a client with dumping syndrome prescribe high carbohydrate diet. What is dumping syndrome? Dumping syndrome is somebody, this is normal colon and the stomach, small bowel coming like that. When they go to, people who develop the dumping syndrome, they go to bypass and they cut a little bit of the stomach. So this is what they left, small stomach, and they bring the bowel and they shunt everything, basically bypass everything. So when you eat, it's dumped right into the small bowel. If they eat a lot of simple carbohydrate, that is sugar, they get dumped into the small bowel, and this then dump into the blood, and your body will see high glucose, therefore it releases insulin. Insulin come and push all the glucose into the cell, and you become hypoglycemic. And so their symptoms is hypoglycemia. They will be jittery, sweaty, palpitation, all the signs and symptoms of hypoglycemia. In order to prevent it, you should not let them eat any carbohydrate that has simple sugar in it. So high carbohydrate is wrong. They eat usually they are on high protein, high fat diet, and high fiber diet. This will help prevent dumping. Therefore, this patient need to be seen. So all 4 of them, something is wrong with them. This is intentionally set. I did this question to show to you that sometimes you have to learn how to recognize bad stuff, not because you're picking one answer from it, but all of them, four of them, they are all something wrong with them. And it's a clear demonstration of how you can put SATA in a priority patient. All of them are priority patients. And that is how you do it, how you prioritized. So we have 4 clients, right? Present with the flu-like symptoms and small purple rash. So the way we do prioritization question here, we go for our acts, the same thing. SATA, who need immediate intervention? What is the case? It's over here. 4 clients present with flu-like symptoms and a small purple rash on the chest. So our acts, we need to immediate intervention. Our case, they have flu and a rash, 4 of them. And a buzzwords, small popular rash, and flu-like symptoms, right? Which of them need intervention? So you look at it and say, I don't know, flu-like symptoms and popular rash. Then you look at the answers, it give you a clue. There's some medications there. So you have to know, based on the medications, you can figure out what is common about them. And all is sulfa drug. Sulfa drug. The sulfa drug, people will develop rash on the chest. Okay, if they take in it and they present with flu-like symptoms. If that happens, you need to stop it immediately. This is Stevens-Jones syndrome, and that will lead to severe rash, hypotension, desquamization. That means the skin will peel and they will die from dehydration. Therefore, we have to look and see who is a sulfa drug. So a client on allopurinol for gout. This is a sulfa drug. Therefore, if he has rash, we need to stop it. So this patient needs to be seen. A client on carbamazepine for tonic-clonic seizure. Yes, carbamazepine is used for tonic-clonic seizure, but does that answer the question? No. The question is here. Carbamazepine is a sulfa drug also. Therefore, we need to stop that. But you got to figure out what to do with the clonic. There's another alternative you can use, but we need to stop this. A client on furosemide for CHF. Yes, LASIS, which is furosemide, is used for CHF, but it's also a sulfa drug, and therefore we need to change it. A client on metronidazole for C. diff. Flagyl, metronidazole is used for C. diff, PO. But guess what? Metronidazole is also a sulfa drug, and therefore we have to stop. Patient is developing Stevens-Jones syndrome, and we need to take away all sulfa drugs. This question illustrates that you need to know all the sulfa drugs and the teaching. Teaching is photosensitivity, so they tell them not to go out without covering themselves, rash, they get a sunburn, sunscreen when they're going out and everything. That one is simple. But the Stevens-Jones is the most serious aspect of all sulfa drug. So you need to know that and recognize which medications are sulfa drugs and how to analyze them. And that is how we do SATA question. So this is a typical NCLEX questions. And the way I do my select and apply is straightforward. You go for the acts, then the case. The acts is the last portion of the statement question. It's always good to go backward. Don't follow what the examiner is giving you. When they write in exam, they put the keywords from the back, from the last sentences. So that's why you do for your acts, the last sentence, then the case, which will give you the rest of the information. And then you look for buzzwords, something that will be ringing in your ear, telling you this is not normal, or this is a clue they're giving you. It's a keywords. And then you rewrite the question so that you can take over. And when you take over, you provide your content, and your content, you make a choice. That is what I'm going to do. You make a choice, you move on, and never compare an answer. So Let's take charge of the question now. Select all that apply. That's our ask. So we got to do some SATA here. And the next, plan of care. So SATA with regard to plan of care. So I have to care for the patient. My answer choice has to be related to care. What is the case? A nurse is caring for an anorexic patient admitted for severe malnutrition. Upper alimentation was initiated. The next plan of care should be, so we have a patient who is anorexic and is malnourished, and we started the patient on upper alimentation, which is TPN. Buzzwords, hyper alimentation on a malnourished patient, what do you worry about? Those are the buzzwords. Hyper alimentation, malnourished patient, and what do you worry about? That's the plan of care. And that's how you can rewrite it. So make a choice. So you decide. The patient coming is malnourished. It's going to be started on nutrition, hyper alimentation. And then what do? What are the things you should worry about? Something should be ringing in your ear. So for malnourished patient, okay, if they are malnourished, so this is the key. So for malnourished, usually your body turn into a starvation mode and you start breaking down your ketones and your fats and sometimes your proteins. And so they really malnourished. So the electrolyte is all destroyed. The key electrolyte, phosphorus, okay, potassium, and magnesium are all depleted. They are very low. They're very low to the point that your body is in need of them. And therefore, these are the key electrolytes. The phosphorus control your respiration, potassium control your heart, cardiac, and magnesium control the rest of your muscular structures. And therefore, all these things, when they are very low, you can see you have respiratory failure, cardiac failure, and the whole body system shutting down. So for these people, when they come in, you have to give them nutrition. You give them half the rate, half whatever calorie they needed. So just calorie, half the dose. The first few days, you monitor their electrolyte, and then you can advance slowly as needed to their calorie that they needed. If you don't do that, they go to something called refeeding syndrome. This is deadly. It's so counterintuitive. The patient is malnourished. I'm trying to feed them. All of a sudden, I'm killing them. They go into CHF, so fluid overload. They go into hypophosphorus, hypopotassium, so hypokalemia, and hypomagnesia. Okay, these are the things that kill them. So you want to be careful and you want to start feeding slowly. And this is the main thing about the disease process. So that's your content. You spend time, analyze it, and you go back and you said, okay, I'm looking at the answer choice. You need to do this before you even look at answer choice. You sit down 10 seconds, think about the content they're requiring. You take your content back with you. So this is the bag of my content. I take it with me here, and I'm going to use it to answer the question. Monitor for fluid overload. Yeah, I told you you're going to CHF. So if you see they are getting fluid overloaded, they may have a refeeding syndrome. Monitor potassium phosphorus level. Yes, you got to monitor phosphorus level. Check magnesium level. Yes. Cardiac monitor. Yeah, you got it. This patient has to be on cardiac monitor because of their potassium will be low. Hypokalemic, they can go cardiac arrhythmia. So yeah. And start TPN half rate. Yes. You start half rate, not the full rate. And that will prevent all these problems. And as you can see, this is all the things you need to do for select that apply. Luckily, all your answers are right. So don't worry about it. If all your answers are right, you can set it that way. Sometimes only one answer is right. Sometimes all of them are right. So this is what we have, and that is how you do select or apply questions. So let's try another one. The same story we're going to do. The client, so select or apply, that's our ask. We have to do some SATA. This is the one question, so we don't have to worry too much. A client underwent emergent subdural hematoma evacuation. The nurse anticipates the following prescription. So the short questions are usually hard to break it down, but just make it easy. You have a patient, he has hematoma, subdural hematoma here in the head. He went to surgery and they drained it. After surgery, what do? This is post-op. What you as a nurse supposed to do? What are your things you expect the doctor will give it to you? All they asking you, this question is, I disguise it to make it difficult, but you have to think. The second level, this is passing level question. I did not tell you anything, but you have to say, hey, patient have subdural hematoma. I don't care about subdural. It has nothing to do with what the question is trying to ask you. Patient had brain surgery. If you have brain surgery, you got to monitor for what? ICP. So all your care, anybody who have brain surgery, no matter what is the pathology, whatever, if they go and do a biopsy, there's cancer there, whatever, ICP is number one. And what do you do with ICP? You don't want the ICP to go up. What will you do? You don't want them to cough. You don't want them to sneeze. You don't want them to strain, right? And then you don't want them overstimulation. So no overstimulation. And you want to prevent edema as much as possible. And so this is the content you're going to use to answer the question. So cough, if I want to prevent patient from coughing, well, don't suction them, okay? Don't suction them. Otherwise, if you continue to suction them, they're going to get overstimulated, right? Sneezing, right? The same thing, nothing go to be along in anything like that, okay? You don't want them to vomit either. So you don't want them to strain, give them stool softener. Okay, overstimulation, don't go there every hour. Don't go and check on them every hour. Don't go and do something every hour. Let them be. Okay? If they need anything, you see the alarm bell will go off and then you can go. So you have to be careful. Edema, we got to give them something to lower the edema. So usually hypertonic saline or mannitol. And then if they have to vomit, we empirically treat them with antiemetic. And this is what you do. No matter what kind somebody have, retinal surgery, whatever surgery they have. So for us, involve the brain. It doesn't matter what kind. It can be subdural, epidural, tumor, whatever. All you need to do is do these things every day to them. So antiemetic every 4 hours, yes. Stool softener, yes. I want you to poop so that you don't strain. Head of the bed, 30 degrees, yes. In a neutral position, yeah, that decrease the edema in the head. Q1 hour vital check. No, it's too much. Overstimulation, and that causes the problem. Okay, so this is, Q1 hour suctioning, overstimulation, patient is going to cough. And 3% normal saline. This is perfect. And this is how we do SATA question. I never compare. I never, I just stick with the plan, my content, and I answer it. Don't compare answers. Make a choice. Read the question backward. Spend time, 15, 20 seconds to come up with your content. And then when you have your content and you're looking at the answer choices, it's easy rather than looking at the answer choices and seeing what kind of content are they referring to. That is the key, that you do things backward. Come up with your content. Take your content containing your bag of content containing information and then look into the answer choice after you've done that. Instead of looking at answer choice and trying to figure out the content, It's the opposite way. That doesn't help. So this is how we do SATA question.